Welcome to all. Today talk about the topic pulse oximetry. Pulse oximetry is the medical device. It is the non-invasive means of measuring oxygen saturation of the arterial blood. What is the oxygen saturation? The oxygen saturation is defined as the amount of the hemoglobin that is bounded to O2 is divided by the amount of total hemoglobin that is available with O2. What is a pulse oximetry? First, the pulse oximetry using the true wavelength. The wavelength light measure the saturation of the oxygen. The light shine through the vascular bed and measure the saturation with the probe. The probe placed into the thumb, finger, bridge of nose, ear and foot, hand. The calibrations is the no required to the equipment. The functions of the pulse oximetry, the normal range of from 95% to 100%. Convenient to the measurement can be continuous. It consists of the peripheral probe, microprocessor unit display and red IF light emitting detector. Then the medical use of the pulse oximetry. A pulse oximeter is medical device. It's the directly monitor to the oxygen saturation of the patient blood. That changes the blood volume in the skin, producing the photophthalmograph that may be further produced into the other measurement. Then working of the pulse oximetry, it have the two light sensor working. One is the red light, another one is IF light. The light source is shined through the fingertip, making the tip appear to the red light. Okay, then analyzing to the light source of the passes through the finger, the device is able to determine the percentage of the oxygen and the red blood cells. Then advantage of the pulse oximeter. To pulse oximeter are the rapid response, the non-invasive and the accuracy, including the intensive care unit, operate the theatre and recovery rooms. Then emergency and casualty used. The pulse oximetry is particularly convenient for the non-invasive continuous measurement of the blood oxygen saturation. The pulse oximeter is useful setting where the patient oxygenation is unstable. Oximetry is useful is any setting the patient oxidations. Then is mainly using the operation theatre and recovery room and the emergency on hospital ward. Mainly is using the patient with the COVID-19 time that the pulse oximetry help with the easily detector. Then the pulse oximeter observe the rapid measurement, the oxygen saturation level in your body without using the needle. Talk with their blood samples to measure the amount of the shown on the screen reflected to the saturation of the red blood cells and the oxygen. It is the normal range 95% to 100%. The SpO2 reading is the pulse oximetry show the percentage of the oxygen is the someone the blood the SpO2 reading level lower than 95%, then higher than maybe 99%. The pulse oximetry is conduct the blood has levels must otherwise determine the laboratory driven the blood samples. Then the pulse oximetry is used to the monitor oxygenations. It cannot determine the metabolisms of the oxygen, that amount of the oxygen being using a patient.